Good afternoon. Thank you, Matteo, and thank you for the organizing committee for inviting me. It's really a pleasure and honor to be here today in Prague and participate in this conference. Before I moved to Qatar, I was in the Netherlands, so I know about the European context in terms of research, but today I will tell you more about what we are doing in the Middle East, especially in Qatar, and how this program, Qatar Genome and Qatar Biobank, came together and lead the efforts in implementing precision medicine in Qatar and in the region. So how do I move? Okay, so QPHI, or Qatar Precision Health Institute, actually the name is quite new. It was launched last year because we are used to be known as Qatar Genome and Qatar Biobank. We were two research centers under Qatar Foundation. And last year, we decided to merge together. We have been working for over 10 years together, but last year, we decided to become under one roof called QPHI. So this is, we'll talk about the mission and vision of QPHI, our journey since 2012, our data and resources, the biobank and the genome, some of our research outcomes, and before I conclude with clinical implementation initiatives and also some of our education projects. So QPHI mission and vision. The mission, as was initiated by Her Highness Sheikh Hamouza in 2012, is to spearhead and lead all the national efforts in implementation of precision medicine, including research and also translational. And as a vision, it's not really a vision, but we have been doing this since a long time, is to establish a research platform in Qatar and through the region to help in the delivery of precision medicine and improve the patient care. So this is our journey. So as I said, the Qatar Biobank was initiated in 2012. A year later, the Qatar Genome Vision was announced, and we start to sequence our first genome in late 2015. On the upper part of the slides is some of our milestones. For example, in 2017, we have linked our participant record, the biobank record, with the EMR data from the hospitals. In 2019, for example, we introduced the MRI screening for all the biobank participants, and I will take you in the next slide about what we are doing exactly in the biobank. And as we stand today, 2025, we have collected over 47,000 participants. They are spanning over more than 60 nationalities. We have released 25,000 whole genome sequence data for the researchers. And we have the follow-up visit, which came after 5 years after the baseline visit for 5,000 participants. We have about 1,500 whole body MRI and brain MRI data. And we also, on the lower part of the slides, you see that we started the population cohort since 2012. In 2016-17, we initiated the Qatar birth cohort studies and other disease cohort, as we called, one for cardiovascular, one for CS, and one for MS very recently. This is in collaborations with researchers or clinicians that they want to use the facilities of our biobank and to have their study nested within the biobank to use our facilities. And also last year, we initiated the Qatar Twin Register because I came from the Netherlands Twin Register. Martina knows that. So before when I was in the Netherlands, so I thought, let's do also Qatar Twin Register in Qatar because there are no Twin Register in the Gulf region. And actually, it's the second one in the MENA region. And we have colleagues from Saudi Arabia, from Tunisia, who want also to follow this example. So this is a schematic overview of the biobank visit flow for the participants, which span about 3 hours, 3 to 4 hours. It's quite extensive data collection and sample collection for each participant, and it is on voluntary basis. And the only inclusion criteria to be part of our biobank is to be 18 years plus or a Qatari citizen or have been in Qatar for more than 15 years. So after registration, we get the consent from the participants. The nurse asks some questions. Then we took blood measures, blood pressure measures. We took other measures. We collect biological samples. We do retinal imaging, saliva and urine collection, ultrasound, IDEXA. And I want you to pay attention to the last step, which is the participant medical review feedback, which is our value proposition to the participants is at the end of their visits, we want to give them some feedback about their health status. And once we collect all the blood measure biomarkers, we get them from the clinic. If there is something that is not good, we also inform them and we refer them to the hospital. As I mentioned before, we also initiated MRI visits, and I will tell you more about in the next slide. So this is the data catalog, and it is available on our website. You can go and have a look into it. We have basically what I call the big five: the questionnaires data, the laboratory data, the clinical measurements data, the MRI data. In addition, we generate also whole genome sequence data and other omics. And all the participants who have consented to link their data to the EMR, we also can get the EMR data. It's not live record linkage with the EMR, but at least we get it with batches. And we have, the recent batch was from last year. This is the MRI visit. So we do brain, whole body, corneal confocal microscopy, and vibration sensory test. And we look at some cognitive tests like attention, psychomotor speed, and others. And we give also we discuss the report with the participants. Not all the participants opt to get the MRI visit. Some of them, they want to use it, and not all. That's why we have lower number comparing to our population cohort. Okay, so in terms of genomic release, our latest release consists of 25,000 whole genome sequence data. We have done it in-house, and we have used the state-of-the-art analysis using Dragon 4.2. And as you know, Dragon is received quite a lot of attention recently because of the high quality and the stringent QC that is performed. And this data now is within the hand of the researcher. We are not doing only genomics, but we also expand our collection to do other omics. For the subset of the 25,000, we have 3,000 with proteomics data using SomaLogic platform. We are now currently running also the Olink platform for the same batch. We have also metabolomics, transcriptomics, and epigenomics profiling for these participants, and a subset on for immunoproteomics. And these are not randomly chosen cohort, but it was based on some criteria like participants who have diabetes or cardiovascular. As we speak now, we are currently scaling up our omics collections to go up to 10,000 for each of the omics. So what we did with this data, what is the outcome so far, and how we are seeing the future, or what we are gonna do with all of this data collected at the biobank. So, but before that, and since we are talking about policies, regulations, I want to mention that one of the pillars of Qatar Genome and Qatar Biobank when we started is also to work with the policymakers, the Ministry of Health, and other regulatory bodies in Qatar, is to produce founding documents and initiating national discussion on genomic research, on Islamic ethics, and writing reviews, white papers, and guidelines. This was among the first things that we did in Qatar. Now, talking about research, so how we organized ourselves in terms of research. We wanted to foster the research in the country. That's why we assembled a consortium called Qatar Genome Research Consortium. And we asked the researcher to come up with ideas that should be answered for any large-scale genome program. They come up with many proposals. We selected 10 projects, and we asked them to collaborate within each other to mine the data that we are giving for them for free. So these are the 10 projects that we initiated in 2017. So we asked them to work on a landscape, a big flagship paper, doing a GWAS catalog, performing the reference genome and imputation panel for the Qatari populations, looking at the cancer landscape, pharmacogenomics, Mendelian disorders in the country, loss of function, HERV, mitochondrial X and Y, and HLA. So they start to work very actively and very hard on this, but since they are not a researcher within with us in our center, they were not really taking it as how to say. They were not so engaged as we wish, because they do have other duties. They are working in their institution on other projects. They are submitting for grants. So the speed was not as we wish, and that's why it took some years until we get our first publications. And I will take you through some of the highlights of the paper that we have published recently. So as I mentioned, we started by looking at the genetic architecture of the Qatari populations. And in this paper, we have, which was published in Nature Communication, we identified 5 clusters in the Qatari populations. Admixture Arab, Peninsular Arab, which is the main cluster that you can see here in the picture with the blue sign. This is not observed in any other ancestry, and this is constitute the pure Qatari cluster. We also observe a General Arabs cluster, West Arab of West Eurasia and Persia, South Asian Arabs, and African Arabs. So this constitutes the basis of the genetic architecture of the Qatari population, and all the subsequent research that we have been doing will look into this sub-classification of the Qatari population, and this is very important. So we looked also at the genetic variability within the Qatari populations. We found over 88 million variants, of which 24 million are novel and not observed in other databases. We have performed GWAS for over 45 clinically relevant traits from the biobanks, and we looked at the heritability. We replicated some known loci associated with BMI height, for example, but we also discovered novel loci. We looked at the PRS. Also, we look at the landscape of germline cancer genes, variation in the Qatari population, and the paper was published in Lancet Oncology. We looked also at the actionable pharmacogenomics genes in the Qatari populations, and we found that there is a distinct distribution of actionable pharmacogenomics genes in the Qatari population based on the clustering that we have identified. Of course, we looked at the ACMG classification, and actually this is the 3rd paper that we have published. We published 2 papers before on using the 56 gene list, and then the recent one on the 78 list genes, and we observed 3.5% of the Qataris carry at least medically actionable variants, and this percentage is not different from what others have been seen. For example, in Iceland, they have seen 3.4%, similar percentage. Of course, as you know, the Middle East is known with a high level of consanguinity. So we looked at the burden of Mendelian disorder within a list of over 2,000 diseases. And we also discovered novel pathogenic variants. And we are now currently validating functionally these variants. And recently also we mapped the genetic landscape of EMD, the treatable inherited metabolic disorder. And this is very important because here we identify novel variations, and what we have seen here is that can inform the public policy and inform newborn screening and career screening. And it's good. I think this is the first paper that has been done on such large scale in underrepresented population. Very recently, we published also a paper in Nature Genetics looking at using long-read sequencing data and identifying novel variants associated with some of the rare diseases within families from Qatar and from the region. So we have almost finished the round 1 of the consortium about the 10 projects that I mentioned, and now we are starting round 2 of the research consortium, where we are shifting a little bit the gears toward more translational research, disease-oriented research. And we have assembled this consortium around 5 focus areas, which are cancer, cardiovascular, metabolics, genomics, and AI, because our data, the MRI data and imaging data, was not used extensively in the first round. So we want the researcher to use LLM and AI to mine this data. We also introduced two new focus areas, reproductive genomics and mental health. And this was not random because according to the reports from the Ministry of Public Health and other bodies in Qatar, there is a lack in terms of research on reproductive and mental health. So that's why we included these 2 thematics. As Qatar Precision Health Institute, we are leading 3 projects. One is called Flagship, where we're gonna look at all the previous results, the previous topics that we have worked on in the first round, but also scaling up and expanding a bit. And we are also working on pharmacogenomics and HLA because we are very much interested into moving toward more translation and implementation. So this is our work on pharmacogenomics. Basically, we want to look at some aspect that we did not cover in the first paper, looking at the adverse drug reaction, looking at drug-drug interactions, using AI to predict medication response, validating the novel alleles using long-read sequence data, doing the haplotyping of association analysis, and so on. The HLA project, as you know, HLA is very important for many research, but also clinical projects, and there is no gold standard for HLA typing. What we did here in Qatar is that we looked at 3 algorithms and we developed our N-1 algorithm, which is in silico typing using our sequence data, and now which give actually very good prediction based on comparison with 1,000 genome data. And we are now in the step of validation using long-read sequence data, but also commercial typing. The aim is to build an imputation panel for the other population to impute the HLA alleles. Okay, since we are here and the session is about international collaborations, allow me please to take you through some of our international collaborations. And this was a project that we did with the Global Biobank Meta-Analysis Initiatives. Is a consortium of 24 biobanks with over 2 million individuals. Is basically looking at the common variation among the biobank traits. The flagship paper was published a couple of years ago, where we contributed, and we also contributed to the round 2 of the consortium, looking at IBS and asthma and allergic disease. Currently, the consortium is focusing on social determinant of health, longitudinal analysis, and also all biobanks, but this is for the large-scale biobank like UK Biobank and all of us. Another consortium where we are actively contributing is the biobank rare variant analysis. It's similar to the previous one, but here the focus is on whole exome and whole genome data. And we are, as you can see, we are the only one from the Middle East contributing to this consortium because we are already prepared. We have the data, we have the team, and we do everything in Qatar. We don't export the analysis. So, we mentioned about health economics this morning. Actually, there is a consortium looking at the healthcare cost. It's called Gene Cost Consortium, led by FinGen, and actually Estonia is part of that. There are 11 cohorts from 7 countries, and we look at the variability in cost across the healthcare system and countries. It's still, we are at the meta-analysis stage now. There's an abstract published last year in the American Society of Human Genetics, and hopefully we see the outcome of this paper soon. GLP-1 also is getting momentum, and there is a GLP-1 research receptor antagonist consortium where we look at the heterogeneity in weight loss outcomes associated with the use of GLP-1 medications. We have calculated the weight reduction in GLP-1 versus bariatric surgery in our cohort. We have done the association analysis with BMI and type 2 diabetes. And actually, the 25% of the data in this Nature Medicine paper is coming from Qatar because there is a lot of the prescription for GLP-1 medication is high because it's free. It's included in the insurance. Back in 2020, we were the first Arab country to participate in the COVID-19 Host Genetics Consortium. And because of the diversity that we brought to the consortium, that was, I think, Mexico and Qatar, 2 of the 51 identified genes either associated with susceptibility or severity of the COVID-19 were only present because of the data from these underrepresented populations. Colleagues from Weill Cornell Qatar, they have also done a great job because they do have access to all the data that has been associated with vaccination in Qatar, and we have been leading some of the groundbreaking results about the vaccine in Qatar, the vaccine efficacy in Qatar. We also took part recently, because also again within the spirit of data sharing, regulation and standards, we took part in the very federated nomad initiatives led by the Broad, and we, together with colleagues from Singapore and from other countries, we are working on developing a federated nomad where we do all the analysis in-house and then we export only the summary statistics to nomad. Peter here is in the room. We are also a driver project within GA4GH. It's a very important organization to promote for best practice in data sharing and regulations. And before I move to clinical implementation, some of the research impact that we have been made, this is not our papers, this is papers by colleagues. Qatar is ranked #1 in the medical research in Arab board countries. And we are also #1 in bringing more diversity to the GWAS catalog. Some of the outreach we have been mentioned together with Estonia, Decode, all of us and other large-scale genome program. And this Nature News and Views article published in 2021, celebrating the 20 years since the first draft of the human genome. We have asked it to write about our personal stories in Nature Genetics and mapping the Arab genome. And the paper that I showed about the cancer and the long read in families has been selected by the editors to be in the cover of their journals. Okay, clinical implementation. This is something that we are taking very seriously. And I will take you through some of our initiatives in this regards. The first one is, as I mentioned, we are doing the population cohort. We continue to do this. But in the same time, we want to enrich our data with disease cohort. And what we did is we established this disease genomic database initiatives. This is a collaborative project between us and clinician researcher in Qatar who has access to disease cohort, whether it is at the university or at the hospital. And the aim is that we sponsor or we do for them the sequencing to generate omics data, but they should return the data that we have generated and make it available for the other researcher after they have published it. So it's a matter of supporting the genomic sequencing, funding and logistics, co-ownership of the generated omics data only, and facilitate afterwards the collaboration and data sharing between the affiliates within the disease genomic database. We do not own the project samples or the phenotypic data. We just co-own the data that we have generated together with the researcher. And we don't do it for every disease, but we focus on some specific disease like cardiovascular cancer, diabetes, which are the national priority disease in the country. Now, moving a bit about some of our initiatives. I start by the Wellness and Lifestyle Genomic Report. This is more towards fit into precision public health, and this report is given to every participant of the biobank, and the aim is to educate the participants, to educate the public about the importance of genomic. We don't give them a report about disease, but we give them a report about diets, exercising, something like that, and it's quite well perceived by the community. In terms of precision prevention, we do breast cancer screening based on the outcomes of the cancer paper. We have identified participants that are carriers of BRCA1 and BRCA2 mutations, and we invite them to the clinic. We do the genetic counseling, we do the confirmatory testing, and then we refer them to the clinic. We have also developed what we call the Q chip, Q for Qatar, Qatari chip, where we have included all the rare variants that are specific to the Qatari populations, but also we have included the variants, the pharmacogenomics variants. And in terms of interventions, we have two trials, one on reactive pharmacogenomics on clopidogrel and the second one on warfarin. And we did it as a pilot for a few hundreds, and now we are scaling up because we got the clinicians are very much interested and they want to expand these trials across the hospitals in Qatar. Now, we have other initiatives that are ongoing. Some of them we started already, like the newborn screening for type 1 diabetes and another one for rare disease. And actually, together with Cedra Medicine, our strategic partners in Qatar, there are 2 gene therapies in Qatar, one for SMA and the other one for DMD. We are looking at the polygenic increase scores also, and we are expanding our carrier screening for all the ACMG variants. We started with breast cancer, but also we are doing the Lynch syndrome soon and expanding on other variants that are relevant to the Qatari population. And together with colleagues from the cancer hospital, we are working on a trial for a new adjuvant chemotherapy. Okay, because not only the data is important, but funds is also very important for researchers. And how we are doing it in Qatar, we have a co-joint fund program with the Qatar funding body, the main funding research body, and we developed grants called Path Toward Precision Medicine. Grants, we give about $700,000 for a period of 3 years. We give free access to our phenotypic and multi-omics data to the researcher, and we ask them to come up with questions that are with the research questions that have implementation aspects. And we develop the priority areas like artificial intelligence, disease risk stratification in populations, integrating the omics data, and pharmacogenomics. It has been a successful program. We started in 2016. Over 40 research grant has been awarded. And now this year, cycle 8 is not here, but a couple of months ago, we awarded 7 projects, I think. We are taking part in the review and the selection of the project and in the designing the thematic area together with the main funding body. And trust me, the research community, every year they are eager to participate and to contribute, because this is a way how we maximize the use of our data. We give them funds, we give them data, and this is their dream. Now, before I would like to conclude with education. This is another pillar of what we are doing at QPHI. We are cultivating the next generation of scientists, researchers, and healthcare professionals, and we do it in many ways. We start from early school years by developing a comic series on genomics. We have a team working on this. We organize visits to the DNA Museum, and we organize also edutainment projects at the schools. We have also developed a mobile game. It's called Genome Heroes. If you go to your phone, you can search it on Android or iOS, and it's in English and Arabic, and it's a funny way to educate the kids about genomics and DNA and so on. We are working with the Ministry of Education to enhance the national science curriculum, and this is quite a successful program as well. Now, genomics is taught for in every school in their curriculum, so they know about genomics, they know about DNA, they know about precision medicine. We have a program called Globalizations Initiative. This is in collaboration with the Ministry of Education as well. And we have a consortium called Empowering Generation Consortium, where we invite students to the university, to the lab, and they spend the whole day and they see what is the life of researchers. For under and postgraduate levels, we have developed 2 internship programs, scholarship programs, and we have initiated 2 graduate programs, one on genetic counseling with Qatar University, and another one, master and PhD on genomics and precision medicine. Okay, so this is another initiative that we have been conducting. It's called diversity. In Arabic, it's called Tanawa, and we are trying to help. Time? Yes, okay, I'm almost done. We are trying to help other countries who are starting their biobank and genomes program, and to give them what we have learned, and this is in collaboration with Iraq and Thermo Fisher. The first workshop was about setting up large-scale programs last year. We had participation from 14 countries, and this year, in a couple of weeks, we are organizing another workshop on clinical research, rare disease, and pharmacogenomics. Next week, we have a big upcoming conference on precision medicine and future of genomics, and before that, we have a masterclass on genomic quality assessment, proteomics, and we have a PacBio Day as well. So if you're in the region, please don't hesitate to come. We don't work in silos. We work with all stakeholders in Qatar, research institutions, hospitals, and universities, and these are our stakeholders. This is the QPHI team. We are not so big. We are about 100 people. And thank you very much for your attention.
Okay, thank you very much, Hamdi, for this very nice presentation. I'd say it's impressive, the level of coverage of different activities that you have, and also excellent publication. It's amazing. I would like to take now some questions from the audience. Yes, we have one here and another one there. I saw Maud before, but
Hello, everyone. I'm Maud Kamal from France, from Gustave Roussy. Thank you so much for this clear presentation, and amazing what you've been doing here. So I come from an oncology field, so I'm really impressed with what you're doing, and I have two questions actually on the biobank that is related to cancer. You know, in France, we have a similar initiative trying to apply whole genome sequencing on cancer patients on specific indications. And I just wanted to know, how do you deal with samples? Just a question, curiosity. Do you use FFPE samples or frozen samples? And how do you deal with the logistics on that? And my second question, I'm really interested in the way you work on clinical data, the annotation of the biobank.
Yeah.
Thank you.
So regarding the biobank, the collection of cancer samples, we don't do it at our biobank, but we are now working with the pathology department at the hospital to establish a tissue biobank. So all the cancer samples will be done at this tissue biobank. Regarding your second questions about the clinical data. So we have developed pipelines for clinical annotation for looking at the VUS variants and how we can easily interpret them. So we are developing the pipelines, but we are also following the international standards for that.
Thank you for your presentation. I am an maxillofacial surgery department's research assistant. So my question is to understand the biobank better, actually. So we know that the oral flora might be responsible for the antibiotic resistancy.
Yeah.
So I was wondering that if you take any oral samples from the patients that you added to your biobank.
Oral samples?
Yeah, oral samples. Maybe that we can use it for
We take saliva.
Yeah, saliva.
Saliva, we have saliva. I don't know if I mentioned this. And we also started recently a stool collection for microbiome research.
Have you been informed again after that biobank researches that any correlations about the antibiotic resistance and the saliva samples? Are there any researches or data about that?
Yeah, I think so. We have a group working on this, but I don't recall the publication. This started quite recently, so you might go to our website and see, or I can give you my
Yeah, of course.
We can discuss it.
Thank you so much.
Iñaki?
Yeah, my question is regarding the, you have said that also you have a mental health biobank.
Yeah.
And that includes neurodegenerative disorders, or it is independent?
Yes, yes, that include neurodegenerative disorder, neurodevelopmental disorders, but we do have also a research center called Biomedical Research Institute. They have a neurodegenerative centers. We are collaborating with them to collect samples, but also to generate omics data on this.
So that includes multiple sclerosis and amyotrophic lateral.
Yeah. Yeah, multiple sclerosis, we started recently. We have, I think, now over 200 patients enrolled in this MS cohort in the biobank.
Yeah, and the other one, it is, you don't have connections with Spanish biobanks, for example?
No.
But, would you be interested?
Yeah, we are part of BBMRI ERIC network.
Yeah. Okay, perfect.
Me? Yeah. Okay. Astrid Vicente from Portugal. Very impressive work. I have two questions. The first one is, how do you enroll the participants and how is the adhesion? How do you get to them? Do you advertise?
Yeah.
And the second question is whether you return results and how do you return results? What type of return result do you have?
So about participants enrollment, we do it it's on voluntary basis, and it's usually friends who bring families. So we do outreach campaigns sometimes in the events, and we have a huge waiting list for the biobank. People are interested to come and to take this 3-4 hours, quite extensive visit, and to be enrolled and to get the health check. About reporting, we do the wellness reporting. This is one kind of reporting that we do. And the second one is we are starting soon. We have actually amended our consent to start to call participants based on the genotype for research purposes. So we do the wellness reporting, we do the reporting for the ACMG variants, and we do reporting based on genotypes. Not pharmacogenomics, no.
No. Impressive. I was there when you started the biobank in 2012. And then 2018, that's review.
Yes.
And Victor Zaug. But what you are reporting today is amazing. But my question is, I remember from this review that you have a Qataris, and now you are involving the ones who have been living in Qatar like 15 years.
Yes.
What about the rest?
I mean, I did mention my slides. Qatar is a small country. It's only 2 million, 3 million, actually, 3 million. 90% of it are expats. And we are looking at the expats who have been staying in the country for more than 15 years, for the only reason that we can't do the follow-up for them, because most of the 90% of workers, they came for 1-2 years and then they leave. And that's why we are focused on the long term, to be able to follow them longitudinally, and we actually have a cohort of 6,000 long-term residents. And we are now doing our third strategy, by the way.
Maybe one last question and then we move.
Sorry, can I have one more? How do you do the imputation against what?
We don't do imputation since we are doing a whole genome sequence data, but we are building a reference panel that can be used by other populations. Our data is representative of 400 million participants. So the whole MENA region, we have data from, as I mentioned, from over 60 countries. So we build a reference panel, and then other people in neighbor countries can use this reference panel to impute.
Okay, because I was I misunderstood, of course, but
yes. Qatari, no, it's based on Qatari, and as I mentioned, there are 5 clusters that represent Qatari, but we do have also thousands of long-term residents we saw from the regions. It's not only Qatari, but there are from North Africa, from Egypt, from Jordan, from Syria.
A lot of diversity, so you don't have many from each, I guess.
Yes, but yes, that's why the aspects of clustering within the specific ancestry group is very important.
Yeah, thank you. Very, very big.
I only have a very last short question because we have to continue. First of all, congratulations. It's always impressive to see how one country is organizing itself, and you have not at all mentioned so deeply, but it's impressive, the connection you have as a program with the policymakers. So really the sustainability, the connection, the push for information. So that's impressive. So congratulations. Yeah. And I have my question, sorry, is we had discussed about it yesterday so much. Are you also talking to the GPs, so the general practitioners? Because I saw the education programs for the new generations, maybe. Yes. How is it with those being in the field already?
Yeah, we already offer them this master and PhD program, so they are pretty much interested. We work also with the primary care to develop the wellness report and smart health initiatives report. About engagement with the policymaker, I was mentioning, I don't know, to Michelle or Martina this morning, that the Ministry of Health is sitting in our board. And this is a good push for our clinical projects in the clinics. Thank you.